So I'm Evelyn Prodger. I've forgotten my own name then. That's not good, is it? And I'm an associate member of the Community Hospitals Association, but I was chair of the Innovation and Best Practice Awards judging panel last year. And Julia and team were one of our winners. So we're really delighted to welcome them here this evening to share a bit more about the work that they've been doing. So I'm just going to whiz around the screen. I'm going to have...
We cover the whole of the map as you can see it, apart from the Eastbourne, Hailsham little purple corner in the end there. As a trust, we're a community trust and we provide care across the whole of Sussex, and within that we have 11 community hospitals, which again are spread widely across that sort of geographical area, but we also provide services around community nursing, children, dental, specialist services, amongst many more really. If we can have the next slide. I just wanted to put a slide in around the context really and how we came about starting what we were doing. And basically the healthcare support worker programme was launched back in September 2019, which seems a long time ago. And it was put in place to support NHS trusts in increasing our healthcare support worker recruitment, look at minimising our vacancies and sort of look at not relying on temporary workforce and having that sort of greater continuation of care for our patients, and also to support more people to progress into nursing and midwifery futures in the roles within the future. And it was based on a lot of the sort of policy documents that are out there, sort of the NHS long-term plan and sort of the priorities and operational planning guidance of 21-22 has come into place since. And I think for us as a trust, we joined the project because we recognised that we needed to value our healthcare support workers. We needed to increase our workforce of healthcare support workers, and we needed to think about also development of that work stream for us as an organisation. So our ambition alongside the programme's ambition was really to recruit more people wishing to start a career in the NHS, and the programme was initially focused on new to NHS, so people that had never worked in the NHS before, might not have even considered a career in the NHS, and how we could encourage them to come into the NHS as healthcare support workers, and how we could look at how we develop that skill set of people with experiences for those healthcare support worker roles. If we can go to the next slide, Helen. So just some programme priorities which became priorities for us as a trust. Obviously there was a national recruitment campaign which we absolutely participated in the beginning, and for us it didn't really work, if I'm honest. Because we recognised that nationally they used a recruitment company who gave us lots of contacts, but actually when we started to interview contacts and meet with contacts that they'd sent our way, they were either really interested in being a healthcare support worker but actually didn't live anywhere near us geographically, or they actually weren't that interested. They'd seen the job and were just applying for a job. And we found that we had much better recruitment through our own recruitment processes. We had central recruitment programs within our organisation, targeting sort of local geographical areas, and we had a much better response from that, although we did recruit some from the recruitment agencies as well. We also were in partnership with Health Education England and the e-learning for healthcare, and we looked at the accelerated care certificate, which is now available to healthcare support workers, which is a much more blended approach of care certificate, and just really look at how we introduce people into our organisation, but also recognising how do we get them to be confident and competent and also cover the care certificate in the areas that they were going to work in. We've also looked at career pathways, and we'll talk a wee bit about that as we go on, but also recognise that within this group of staff, some staff join us with a really clear aspiration to go on and be a physio, a nurse, an OT, but some people just want to join us and do a really good job and actually just have a specialist interest in perhaps infection control, or just want to take a lead in something in the organisation. So we recognise that some people we would absolutely be supporting on a career pathway, but for others it was about how do they get good job satisfaction from coming to work and working with us and alongside us. We did have support initially in the project with our regional team and also with NHS England, and we do still report to them nationally about how many vacancies we have currently, and what our retention rates are like as well. So we have good knowledge of how we're doing as an organisation. We can have the next slide, please. So initially the project team comprised of myself, and initially 2 healthcare support workers, Bev and Angela, who are with us today, who moved into Band 4 educator roles as part of the project. And we also employed a practice development nurse, Lucy, who was a Band 7 registrant, who was the project lead. We've now extended that because we now have an additional 2 Band 4 educators who work out in practice with our teams. And all of our posts now are substantive. Originally, we had project money, and that came to an end. And we knew that we were doing such a brilliant job that we couldn't lose them, and we needed to continue the momentum with this team. And we managed to secure substantive roles for all of them. And both Bev and Angela and the project lead sit within our education and development team. A key focus, as I said, was on recruitment and retention, but also alongside healthcare support worker education programmes, and how do we support people to develop, how do we support people to progress. We worked incredibly closely with our HR department and our organisational development department. And prior to the team starting, there was a real recognised deficit in dedicated support for this staff group. And what we've done throughout the project and continue to do is to raise the profile of healthcare support workers to have much more job satisfaction, role progression, as I've said. And also as part of that, we were running a community hospital transformation project, and a decision was taken earlier on, hang on, which year are we in? Last year, because we're in January now, to uplift all of our healthcare support workers from a Band 2 to a Band 3 in our community hospitals. Which was quite a decision to make, really. And what we did was we did a sort of healthy conversations with all of our healthcare support workers to just be assured that that's what they wanted. And I think out of the numbers we had, I think we had 4 or 5 healthcare support workers across 11 hospitals who didn't want to be uplifted. And then we uplifted their pay to a Band 3. And then we did the work with them in terms of competency, sign-off, care certificate. We had to do quite a big piece of scoping where we recognised historically a number of staff had either attended their care certificate and not had their workbook signed off. They might have escaped somehow or another doing their care certificate and starting with us prior to the project. So those staff had to go and do their care certificate. And then we had to look at how we invested them and supported them with additional competencies and skills such as wound care, catheterisation care, etc. So it was a really, really big piece of work, and the healthcare support worker education team has really helped us to focus this piece of work for it to happen, and to also support staff with that transition. If we can have the next slide, please. So what have we achieved? And you'll see the lovely Angela and Bev there who are on the screen with us this evening. So I think we've got a really confident support infrastructure for our healthcare support workers. As part of the beginning of the project, Angela was successful in a clinical fellowship role, which really supported us as an organisation because she was working very closely with NHSE and absolutely supported the project with other fellows from other organisations. We felt early on that as educators, they needed to have a specific uniform so they were recognisable when they went onto the wards. And both Angela and Bev came up with this uniform of choice, which has carried on. We started a 2-week induction programme for all new healthcare support workers joining the trust. So they became supernumerary for the first 2 weeks. And within that 2 weeks, we do cover the 15 standards of the care certificate, but we also cover what it's like to work for us, basic skills that they will need, how to access the IT systems, how to log into systems, how to claim their mileage. So all those sort of practicalities of joining a new organisation. And then at the end of the 2 weeks, both Bev, Angela and their colleagues will go out into practice and meet the individuals in their team settings, make sure they've settled in, iron out any additional problems they may have, and then start working with them in building that confidence and competence around some of the skill sets that we require of them for role. I think we've also extended our pastoral support offer to healthcare support workers. I don't think they were getting a lot of pastoral support. But now we have a number of staff who Bev and Angela will work with over pastoral issues, supporting mileage claims, supporting cost of living issues, and they get involved in all sorts of things that I don't think they ever thought they would get involved in this role, but have been incredibly supportive to this staff group. As I said, they follow the healthcare support workers, so they join us, they're supernumerary, they have 2 weeks in a sort of classroom type setting, and then join their teams, and the care certificate educators follow them out into practice and support the teams in getting them up and ready to practice as healthcare support workers. We've developed a healthcare support workers forum, which Angela and Bev are completely in charge of, and it's a psychologically safe space for healthcare support workers. So nobody above a band 4 is allowed to attend the meetings in any shape or form. If you try to join, they will hunt you out and take you out of the meeting group. So I'm only invited by invite, and I have to request an invite and some time to spend with the team to talk through. I don't know, I'm meeting them in a couple of weeks to talk about our community improvement project. So it's a safe space where they can say how they're feeling, what the issues are, what the challenges are, what's working well. And then Bev and Angela and the team will then bring that out as themes to us to look at as an organisation about actually what do we need to do about this? Well, how can we think about this? Is this common, or is this something that's just affecting one individual, and how can we support that individual? We've utilised and developed, with Angela's help, on the NHSE and the fellows, some new advertising material as well, because we recognised we weren't really talking very much about healthcare support workers and the role that they did. If you looked at things like our job descriptions, they were very, what's the word, unfriendly, in terms of it wasn't really clear what the job of a healthcare support worker was. So I've, on a further slide, I've shown some of the work that Angela and her colleagues have done. So if we can move on. As part of the project, we've reviewed all of our job adverts and our language within our adverts. As I said, it's interesting also the induction programme brought around some sort of real eye-opener moments for us, when I think we all work in the NHS, and actually sometimes we forget the language we use, and we talk in NHS spiel, medical spiel, nursing spiel, and because we're used to it and we work in it every day, it's just our common core language. But anybody coming into our services to work with us who's never worked in the NHS before, it sounds like Mandarin. So we've really looked at our adverts, really looked at our language within our adverts to make sure it's really clear that people, when they're looking at those things, are understanding the role and what the ask is and what the potential is within those roles. We look to our healthcare support worker educators as being part of our interview panels for healthcare support workers now as well, which is really key. And we've had some really interesting challenges for our interviewers and questions where we've looked at the questions that are being asked at interview, and they're really not appropriate. They're not value-based. There might be questions like, I don't know, what do you think UCR does, and what do you think your place in UCR is? And unless you know that UCR is an urgent responsive service and the role that team does, you're not going to be able to answer that question. So the team have really challenged interviewers and the questions that they put forward at interview panels. And I think we've come up with a sort of framework in 3 words, that actually what we want to see from people at these interviews is that they are kind, they're compassionate, and they're motivated. And if we can draw that out of people within an interview situation, then actually the rest can be taught. And we've also challenged the way in which our interviews are held. So traditionally, as I'm sure many of us have been, you go to an interview panel, there's 2 or 3 people sitting in front of you, and there's firing questions going on. And what we're trying to do is have an approach where it's almost like a coffee catch-up. Tell me about yourself. Tell me about what you like doing. Tell me about your strengths. Have you ever looked after anybody? Those sorts of questions, but in a much more sort of informal setting where you get more out of the people that are coming to see us. We developed a dashboard internally, which has a key focus on healthcare support workers, vacancies, starters, leavers, length of service, etc. Just helps us to monitor where we've got gaps or any themes happening, so we can put some invested effort into areas, but also look at why people are leaving if they're leaving, and what is it that's making them leave. Is it that they have desires to be a nurse and are going on to progression, or is it that it wasn't for them? And if it wasn't for them, helping us to understand, what did we do wrong? How do we tell you the story differently that you didn't realise what you were coming into? So we've got quite a lot of data about leavers, etc. We also do career clinic work, working with staff who have aspirations, and also working with our healthcare support workers who have specialist interests. So we have staff who have taken up the mantra of being infection control champions for wards. We have staff who have wanted to access training to have career development. We've also had staff who want to work in specialist teams, and how do we get them to that place where they want to be. And we're also seeing within our community hospital projects how important healthcare support workers are to both our board round safety huddles and our multidisciplinary team discharge meetings. And I think prior to the project, these staff generally weren't going to these meetings. They were out delivering care, but actually it's this group of staff that know our patients so well, and actually can sometimes give that key information that we need to know what to do to promote a discharge, etc. So if we can have the next slide, please. As part of the project, we worked with West Sussex County Council and also the Department of Health and Department of Work and Pensions and University, because we discovered that within Crawley, one of our areas, we had 1,000 refugees moved in from Afghanistan into a hotel environment. So we did an awful lot of work with them looking at recruitment and employment, and also worked with them around utilising our nursery resources on the Crawley site. And that was really helpful. We didn't employ many people from that group, but that was primarily because they were being moved from the hotel into sort of accommodation in other areas. So it was almost stopping them applying for jobs locally, because they knew any day they were going to be moved to somewhere else and never quite sure where. But we did do a lot around application processes, interview processes, and we've actually employed one of the refugees is our administrator in the healthcare support worker team at the moment, and she's been working with us for the past year, which has been brilliant for us. We, as I said, as part of our safer staffing establishment, we recognised that we had an inequitability across the trust, so that our healthcare support workers who worked in the community setting in district nursing were paid at a band 3, and our healthcare support workers in intermediate care units, as we call our community hospitals, were paid at a band 2. And we've done that big piece of work that has now rebanded them at band 3. And actually we have got everybody, bar from probably one handful of people, have got through their care certificate. They've been signed off their competencies and are working through additional skills, which are new skills to them, such as phlebotomy, etc. And we did that over probably a 6-7 month period with a lot of investment and a lot of people who were what I would consider to be enablers. So we had weekly meetings about every single staff member and what it was they needed and what it was they weren't getting, and how could we support them to attain the skills that were required of that band 3. We've given our healthcare support workers permission to be, and I didn't need us to give them permission because they already had permission, but we've helped them to be innovative and creative. And we had one of our healthcare support workers who designed a fluid encouragement signage in dementia-friendly colours, and was supported by NHS England with a £1,000 grant in getting those signs printed up for our wards to encourage patients for drinking and fluid intake, and also supporting other people on the ward who may not be looking after the patients but may be worried about pouring them a drink, that actually they can pour them a drink and they can refill their jug. And that's been really, really successful and led by one of our healthcare support workers, which was brilliant. We just supported her with that. We've also got a pilot looking at visual fluid charts for patients to complete, which is currently underway. And we developed a newsletter. I say we, I'm saying we like it's a royal we. Angela and Bev and team developed a newsletter for the healthcare support workers, so they get regular updates on what's going on, what's available, training, education. And I think also what's important about this is we've also carved career pathways for non-registered staff into areas like education, training and development roles. So we didn't have an Angela and Bev in our education. We didn't have a healthcare support line in our education and training development. So we've given them a career pathway into education. And for them, I think it was, and I'm sure they'll probably tell me off, but they've been absolutely amazing. But also it was a massive transition for them to come out of clinical roles and then to be expected to be standing in front of big groups of people teaching them. So they've had significant journeys, which I hope they might talk to us a little bit about when I've finished. If we can move on, please. So these are just some of the things that we have done. The We Are Healthcare Support Workers, the yellow poster there is something that we use throughout the trust. It's a piece of work that was completed by the NHSE clinical fellows Angela being part of that. And we use that very much in our advertising campaign, which really breaks down some of the roles that healthcare support workers get involved in. We use it in its poster format, but we have used it where we've taken bits of it out and used bits of it as sort of promotional material for us as well. The bottom corner is really around our NHS support worker welcome pack, which again was developed by our South East Region fellows, and again something that we use with all of our new starters. And then we had our first healthcare support worker celebration conference in October, which seems ages ago now, but it was so successful. We had over 120 people come and actually had a huge celebration about the work that they were doing, the project they were involved in, wonderful presentation of their certificates and care certificate badges, which up until that point we really hadn't done. We'd perhaps sent them a certificate in the post. And so we've really started celebrating their successes. And I don't think as an organisation we recognised how much work and how important that care certificate education course is, and how much work and effort goes in. And I've definitely sat with Bev when she's signing people off with their workbook and listened with absolute sort of fascination and curiosity about their reflections and the depth of their thinking when they're caring for patients. So I think it's important that we celebrate that, and we do it really well now, I think. Next one, please. This is just some pictures of us with some of our awards since the team have been made substantive, really. So we've got our lovely CHA award, which we're incredibly proud of. We've also won award, a highly commendation from NHSE about our work with the refugee community as well. So again, really proud to be out there and actually being in a position where we can sort of put ourselves in for awards, because actually we need to be celebrating the work that we're doing and representing our healthcare support worker workforce. The next one, please. And so sort of moving forward, what's next for us? Some of the things that we're working on is, importantly, the team are now substantive and are working within our education and training team. Prior to that, they were working as part of a project team alongside myself. And also we're looking at a role title change for them, which has been a bit of a bugbear for me since I started working on the project with them a couple of years ago, that the title of their roles, care certificate educators, doesn't reflect the work they're doing in any shape or form. And I think care certificate educators, the care certificate is a very small proportion of the work that they do. The rest of the work they do is around development, it's around career conversations, it's around coaching, mentoring, as well as the pastoral support. So they're going to have a role title change, which is associate educators within education. We're working on consistency in our interview panels and questions, because some people somehow seem to get past us and they'll do a healthcare support worker interview and we don't know about them. We lose them in the system. They don't come through to us, or we find them on recruitment, because we get told of all new starters who are healthcare support workers. And we think, well, that's really funny. How did they get a job? Because actually we weren't on the panel. So again, it's just making that consistency and having a healthcare support worker present on those panels and questioning. We're looking also as a trust to encourage representation of healthcare support workers at trust meetings. I think it's really important. I think it's important that we need to hear from our frontline staff about how life is for them. And I think also they have the best ideas about how we need to move forward. So definitely looking with my own portfolio about how we encourage representation and how we release them from practice to come and help us with some of the work moving forward. We're challenging the learning culture. So we're just running our first healthcare support worker preceptorship program, which is a first for us. So really keen to see how that's going and follow that through for our first cohort of staff. We're looking and learning from the case studies that we've had and the people that we've worked from. And some of our healthcare support workers are sharing their story of their journeys in the NHS. And at our celebration event, we had a couple of healthcare support workers who were incredibly brave and came and stood in front of 120 odd people telling their story about how they joined the NHS and what the experience they'd had and how we'd supported them and what went well and what didn't go so well. And I think we're continuing our forum quarterly held by I've said care certificate educators, so I don't think their title's changed officially yet, but we'll be continuing that forum with them, looking at how we can support them moving forward. And then I think it's my last slide. in a whistle-stop tour. I just put this in it that when we find a courage to use our voice, it has the power to positively inspire or change the lives of others. And it's part of the special gift you have to offer the world. It's something to be cherished. And I think for us, that's what we've found through this project, that we've given our healthcare support workers a voice. We've given them the confidence to use their voices. And we've still got a significant amount of work to do. But I think we've made a huge chip in the block in terms of moving forward and having them recognised as a hugely important and valued part of all of our teams, really. So I was just reading through things and saw that and thought, you know what, that just sums up really the role of our care certificate educators and the project team, but also the importance of listening to our staff, really. And that was a bit of a whistle-stop tour, and I'm sure there's more to say. So I don't know if Angela and Bev want to add any comments to anything, or if I've missed something dramatic off.